Today we're here with Dr. Delia Dobrescu, our electrophysiologist. She's going to be talking about devices such as pacemakers, defibrillators, and arrhythmias. Hello, Delia.
How are you today?
Why don't you tell us a little bit about what an electrophysiologist does?
Electrophysiologist is a specialist, cardiac specialist, specializing into electricity disorders of the heart, including cardiac device management, atrial fibrillation, and stroke prevention.
We hear every day about atrial fibrillation. Why don't you tell us about atrial fibrillation and what the new management and treatments are for atrial fibrillation?
Atrial fibrillation is a very common arrhythmia. It is present in millions and millions of people. It's felt like irregular heartbeat. It's felt like something rumbling in the heart, like beating drums, fluttering of a chest.
So frequently we may have a patient that walks into our center and they feel their heart racing, or they feel what they call palpitations. We put them on a monitor and we see that their heart rates at times are as high as 150.
Absolutely. AFib can be slow and can be fast. Can be fast and can produce symptoms. Also can be totally asymptomatic and is just detected because the routine visit.
And frequently we may have a patient that has known blocked arteries or valve problems, but can you get atrial fibrillation with a normal functioning heart?
Absolutely. Happens all the time. It's so-called lone atrial fibrillation and starts in people as young as 20s or 30s. They will feel very, very symptomatic at times, and they will describe this to us.
What's the danger of atrial fibrillation?
Danger, not really in young age. Danger in old age would be danger of stroke, danger of passing out, but primarily the most important risk of atrial fibrillation is go undetected and stroke producing.
Now I see that not only you treat atrial fibrillation, you treat all arrhythmias, and frequently some patients require pacemakers. What would be an indication for a pacemaker, and maybe you can show us what one of the wires looks like?
Indications for the pacemaker nowadays include any bradyarrhythmias that is producing symptoms.
That's a slow heart rate?
A slow heart rate where the heart rate would go below 30 while sleeping or below 40 while awake, producing symptoms like passing out, fatigue, shortness of breath, or even chest pain at some point. The device-based therapy at this point is called pacemaker. Have been on the market for a very, very long time. And what we do, it's a simple procedure in which we do two wires inside the heart and we attach them to a pacemaker.
How long does one of those batteries last?
Nowadays, last a very long time, 7 to 10 years, depending on the procedural numbers. Maybe even longer than that. This is, for example, an atrial lead that is atraumatic for the heart, and this is placed in the upper chamber of the heart and has a fish hook at the end. And essentially what it does, it sits in the heart, gets hooked to the tissue, and then we deliver small electrical energy through it, and this way the patient would have replaced the normal electrical activity of the heart. This lead in here, it's a different kind, and this goes into the ventricle, and what this does is also sitting in the heart, seeing the normal electrical activity of the heart, and then through a connection with the device, the small amount of energy would be delivered in the heart muscle itself, essentially replacing the normal electrical activity of the heart. The patient would not feel this, and they generally recover after the procedure in a matter of days. They generally go home the next day.
Yeah, it's interesting. Years ago they'd be in the hospital, but now sometimes they even go home the same day after a pacemaker's been inserted.
Right, this is an implantable loop recorder, and what this does is actually monitor the electricity of the heart for 3 years. The battery life on this is about 3 years. Can detect atrial fibrillation, which can be a cause of cryptogenic stroke. detecting rhythm abnormalities otherwise undetectable by other means of monitoring, including Holters and long-term non-invasive cardiac monitoring.
That's great, because we have many patients that come in, we put a Holter monitor on them, and after 24 hours we find there's no arrhythmias. But the patient over years complains of palpitations and dizziness. One of these devices that can be left up to 3 years, you definitely will catch an arrhythmia by then.
Absolutely, and it's very easy to monitor as well. We can monitor over the telephone, we can monitor through a lot of means, and we can see exactly what's going on in a symptomatic patient. That's the key here, actually. We have to actually detect what is causing the symptoms. Without detection and proper diagnosis, we can only guess what is needed.
Well, let's turn to a problem where we have many patients that end up with weak hearts, whether they had blocked arteries or valve problems, and they develop these serious arrhythmias because of the weak hearts. Tell us a little about the defibrillators and the state of the defibrillators today.
If you want a super pacemaker that goes into someone's body through the same minimally risk procedure, detecting the rhythm abnormality that could happen in a patient like the one you described, and actually delivers high energy to restore the normal electrical activity of the heart, and essentially saving someone's life. If somebody passes out outside and has sudden cardiac death, then is brought to the hospital. There are some steps that we all have to take, and once is proven that there is an arrhythmic problem, then the next step is a defibrillator implantation, which is going to save the patient's life in the future.
And believe me, many patients have been saved from sudden death with these devices.
We have nowadays a lot of ways of diagnosing heart disease and diagnosing arrhythmias in particular. We can diagnose supraventricular arrhythmias, we can diagnose atrial fibrillation, we can diagnose ventricular arrhythmias, and based on some electric numbers we get, we can actually see how the patients will gonna do in the future.
Well, Delia, this is very informative. Thank you for your time, and Delia is our electrophysiologist here in Middletown.
Thank you.